apa?
Hello, good afternoon. I'm Dr. Rachael Tay, consultant pediatrician here at Oriental Malacca Straits Medical Center. Today, I would like to share with you some common worries of parents, especially new parents. If you're a new parent watching, congratulations on your newborn. Welcome to the world of parenting. Many parents, when they bring their babies home for the very first time, they are overwhelmed with this whole new set of challenges and this enormous task of taking care of their little one. Many thoughts and questions are running through your minds. What should or shouldn't I do? What can or cannot I do? What is normal, what is not? And on top of that, you are now going through this daily routine of feeding, burping, diaper changing, which may seem like a never-ending cycle. Not to mention being sleep deprived due to the high demands of your little one. So in the midst of adjusting to all these changes, parents are also constantly worried about the well-being of their babies. When should I rush to the doctor? When can I wait and see? The list of questions and worries sometimes feels endless. So let's go through some of the things that may seem scary and worrying but are actually quite normal in babies. So some parents have actually asked me, my baby has been sneezing a lot, is it normal? Yes. It is normal for newborn babies to sneeze frequently. It is their way of clearing up the dust, mucus, and even milk from their nasal passages. Sometimes when baby vomit, the vomits can go up into the nose, and that's why they do tend to sneeze as well, to just remove all this. It is very common and nothing to worry about. However, if you have your baby has other symptoms such as fever and cough, then yes, you may want to bring to your baby to the doctor to be checked. Another common concern is baby spit up. So it is actually quite horrifying to see your baby spitting up, and especially sometimes when it seems like the whole content of their feet came out together with a spit. However, it's not a cause of concern if your baby is well and is gaining weight. About 50% of babies, normal babies, do have spit ups. So there are certain things that you can do to reduce this, such as burping frequently, not to overfeed, and keep your baby in an upright position, especially during feeding. How much does a baby sleep? Newborn babies sleep most of the day. So on average, baby sleeps about 14 to 18 hours out of 24 hours. They will wake up for maybe about half an hour to 1 hour, and then they will take naps about 15 minutes to even 3 hours at a stretch. The other common concern is my baby is having snoring. So babies are surprisingly noisy breathers. At times they breathe through their nose. So because of the small passages of their nasal passages, sometimes they can have mucus or even milk that may make it seem a little bit congested. So snoring, snuffling or snorting are perfectly normal to hear from a healthy baby. The noises can be very disturbing to a new parent especially, but it usually doesn't even concern the baby. As long as your baby is not distressed, meaning that your baby can feed well, your baby can sleep well, it's usually not a cause of concern. Poop. Breastfeeding poops are yellowish in color, mild smelling, and yes, it does come with an explosion sometimes, but it's totally normal. However, saying so, if your baby's having explosive food and their stool is very watery, this may be an indication of diarrhea, so you will want to bring your baby to the doctor for a check. So other things are like dry skin, which is quite common in babies as their skin is shedding and they're changing for new skin. Having gone through some of the common worries of parents, which are normal in babies, there are certain instances when you want to be a bit more cautious and you will want to consult a doctor. So I'll talk a little bit more about fever. Fever in children is common, so regardless whether you're a new parent or well-seasoned parents, it is still quite worrying to see your child having a fever. So what is fever? In general, temperature of above 37.5 degrees is fever. So fever is actually a sign and symptom that your body is having. It's not an illness itself. So it's actually a way of your body, baby's body, fighting an infection or fighting a condition. Right, so if let's say your baby is having a temperature of less than 37.5, more than 37.5, under 3 months old, this is not normal, so you will want to bring your baby to the doctor as soon as possible. If your baby is over 3 months old and having a temperature of more than 37.5, you may want to wait and see, provided they don't have any danger signs. So what are the danger signs I'm talking about? So certain things like extreme tiredness, refusing to feed, dehydration, difficulty breathing, fitting, or having a rash. These are indications that you need to bring your baby to the doctor immediately. If your baby is also having a temperature more than 3 months old to up to 2 years old, temperature of more than 39 warrants a doctor's visit, and if more than 2 years old and above, a temperature of 40 degrees. Sorry, let me clarify that again. Okay, so let's say your baby is 3 months to 2 years old, any temperature more than 39 warrants a visit. More than 2 years old, any temperature of more than 40 degrees need a visit to the doctor. So I mentioned dehydration earlier. So dehydration is very dangerous in children. So you need to monitor for these signs at home. So what are the signs of dehydration? So dry mucus, meaning dry mouth, they are crying without tears, passing less urine than usual, or even not active. So these are the things that, these are the signs that you can't keep your baby at home and you really need to bring to the doctor. To prevent dehydration, you need to feed your baby frequently with fluids. Okay, so alright, I see. Thank you, Siti. Siti asked a question, but let her finish typing first, and then I will answer the questions after we run through a little bit more. Okay. Another common question that I've been asked in a clinic setting is stuffy nose. So what causes a stuffy nose? Stuffy nose can be caused by infection, usually the common cold, or sometimes allergies. So there are a few ways that we can actually relieve stuffy nose at home, such as feeding more. So the reason why we want to feed more is we want to prevent dehydration, which can actually dry up your mucus, which makes your baby more difficult to remove whatever mucus they have. Other things are like normal saline drops, and also a humidifier. Okay, when do you want to see a doctor if you have a stuffy nose? So let's say if your baby's stuffy nose is lasting more than 2 weeks, then yes, you may want to bring to a doctor to see whether everything is in place. The other symptoms associated is if your baby is having high fever, having swelling at the side of the nose, the forehead, or even the eyes, then you will want to get a doctor's consult. The other thing is difficulty feeding, difficulty breathing. So naturally, these are all things that you will want to bring your baby to see the doctor. So that is just a short sharing about some common worries that parents have. So I would like to try to answer some of the questions, so feel free to ask. Okay, I'll go back to Siti. Thank you, Siti, for your question. Baby used to poo daily, lately only twice a week. So and she says that read online it suggests that it is not it is nothing, but she's still concerned. Is it a constipation? Okay, thank you, Siti, for the question. Yes, baby poo is a very common question. If baby poo too much, we are worried. If baby poo too little, also we are concerned. So it really depends on the age of your baby, Siti. Let's say if your baby is a newborn, then it depends again. If your baby is in the first few days of life, having about 1 to 2 passage of motion is quite normal. And then as your baby grows a little bit older, the frequency of the poo may be as frequent as the feeding, meaning about 8 times a day, or sometimes it can be even 7 to 10 days once. So it's really a range. So it is not constipation if your baby is passing stools that are soft, your baby doesn't have other symptoms such as vomiting or abdominal distension. Okay, I see another question. Hi Amin. Hi. Ubat demam sumbat atau cecair, yang mana satu bagus untuk bayi? Okey, ubat demam kedua-duanya pun sesuai, tetapi kena faham apa indikasinya. Macam saya cerita tadi mengenai demam. Demam ialah satu simptom atau sign yang baby sedang melawan sesuatu jangkitan. So bukan semestinya kena rawat dengan ubat kalau baby masih aktif. So tetapi kalau saya cakap tentang ubat demam cecair, kalau katakan baby masih boleh minum, kita memang galakkan ubat cecair melalui mulut, sebab ini lebih selesa untuk baby berbanding dengan kalau kita bagi ubat melalui ubat sumbat. Lagi-lagi kadang-kadang kalau baby ada cerit-berit, so ubat sumbat ni memang tidak sesuai. Zira, okay. Hi Zira, okay. I'm a new mother. What should I do if baby asyik nangis? Okay, so ada banyak sebab baby nangis. Okay, so kita kena perhatikan lah. Kadang-kadang contohnya ialah baby, kebanyakan kita kena make sure beberapa benda kita checklist lah, macam ada checklist. So contohnya katakan you kena pastikan baby ada minum ke tak. Mungkin baby lapar, that's why dia nangis. Kadang-kadang lepas minum baby masih menangis, kadang-kadang ialah sebab dia kurang selesa, maksudnya dia ada angin, you kena sendawakan baby. Another reason kadang-kadang ialah sebab dah kencing ke dah berak tak selesa, so mereka nangis. And then commonly ialah sebab baby nak dukung, nak kasih sayang mak ayah. So kalau you punya baby ialah bawah 6 bulan, jangan risau tentang kita manjakan adik. Memang okey untuk dukung adik, memang okey untuk dukung baby untuk bagi kasih sayang. Tapi katakan adik lepas you tengok semua benda ni, dah sendawa, dah bagi susu, dah tukar lampin, tetapi dah pegang pun masih menangis. Kalau baby menangis tak berhenti-henti, ini tidak normal, and saya rasa lebih baik bawa baby untuk jumpa doktor. Okay, hi Elaine. Elaine asks, is it okay to feed below 6 months old baby water? She is half breastfeeding. Okay, yes, this is a very common question that I get in clinic setting as well. No, we do not like to feed baby with water under the age of 6 months old. There are so few reasons to it. Okay, so baby's stomach is actually quite small. So imagine if you fill up your baby's stomach with water, they will not really want to feed either formula milk or breast milk after this. So this will deprive your baby of the needed calories, so we don't encourage giving water. The other reason is your baby's kidney under the age of 6 months old is not mature enough to really filter water, so they're actually at risk of water intoxication. Water intoxication is dangerous because it can cause electrolyte imbalance. So meaning, I will just mix a bit of Malay, garam galian in your body, like and if your electrolytes are not balanced in your body, this can cause your baby to have seizures. So just on top of that question as well, because many parents have actually asked me, so is it okay if I dilute your milk? So the other common thing they like to say is, my baby is having constipation, so that's why I dilute my milk. I will say strongly follow the recommendation of the milk, formula milk packaging. So because different formula milks have different ratio of dilution. For example, a lot generally is 1 spoon to 1 ounce. So you follow this. Try not to dilute it more than you should, because again, like I said, you deprive the child of calories, and also you may have the risk of water intoxication. Hi, okay, Amirul asks, my son is 2 months old, still got ruam susu. Yes, that is common. As long as you have milk, there will probably be a milk rash. So even if it's 2 months, sometimes it may even last more than 6 months. As long as your baby is well and doesn't have any other condition, then this is quite normal. Hi Rishi. Rishi asks, if baby has a rash on the neck, what can I do? Okay, so we want to look at what is the cause of the rash. If, let's say, again, depending on how old is your baby. So if your baby is an infant, meaning less than 12 months old, rash in the neck sometimes a lot of times are actually saliva irritants, meaning that when your baby is drooling a lot, so you have wetness over the neck, and this can sometimes cause a rash. So what I would suggest is frequently dry the area, clean with water, and then dry it off. And you might want to use a beep but you need to remember to change your bib frequently. Other things that you can use over the counter medications are cream. Again, you will want to see which cream is suitable for your baby. So the common ones that some people use are like pseudo cream, Ceradan, and if you're not sure what cream is suitable, you may ask your doctor's advice. Zita asks, is it a must to burp baby after feeding? Sometimes he doesn't burp. Okay. Regardless of whether you're formula feeding or breastfeeding, yes, I will strongly advise to burp your baby. This is to prevent the speed up of baby. So because sometimes when a babies drink, they do take in some amount of air. Even breastfeeding, some people, the old thinking was like, if you breastfeed, you might not need to burp your baby. But yes, we will encourage you to burp your baby, especially to prevent speed up. And it's also generally for their comfort. This is also to prevent colic. Hi Wenjun. Wenjun asks, I think it's common for children to fall and knock their head. When should I be worried about a serious head injury? Okay, yes, we want to see, it really depends on the height and the mechanism of action. A lot of times, baby is running and they fall. It depends on the impact of the fall. Let's say if it's from a high height, like maybe for example from a table down, then I'll be a bit more worried instead of a chair, for example. Again, depending on how high or how tall your chair is and how tall your table is. But the things that to look out for is whether your child has loss of consciousness, meaning whether they are actually not conscious when they fall, that's one, and then they regain their consciousness, or they have frequent vomiting, or they are not acting themselves. These are danger signs, and we will strongly encourage you to bring the doctor, your baby for a check, because sometimes mild concussion, children can have mild concussion from the fall. Okay, hi Yvonne. Do you assess ADHD children? Yes, we do provide a simple assessment. Usually it's a doctor's consult. We will ask you certain questions and then we will examine your baby, your child, and we can diagnose ADHD. Hi, Amin says thank you for the answer earlier. Another question. Okay, let's wait for him to type it out. So as a parent, you usually have many questions to ask. So feel free to ask. Even if I am not able to answer your question, get to your question during this session, you can just type it out and I'll answer in the comments later on. So okay, another question: is walker good for babies to learn walking? This is quite controversial, but the latest guidelines actually do not recommend walker, because this can actually this can affect their hip. It's not good for the development of the hip, so we do not encourage using a walker. Plus there's the dangers of it as well, because when you use a walker, sometimes accidents happen in you know, it's so sudden. Sometimes you don't even, in a blink of an eye, the child might get into trouble. So if the baby is on a walker, they are actually more mobile and they're actually at a higher height. So meaning they can pull, they might even reach your table, they can pull down your tablecloth, and sometimes if you have hot water or anything on it, it's actually quite dangerous. I'm sorry. Hi Shahira. Okay, yeah, okay. What are the signs of colic? Okay, so signs of colic in general, excessive crying, especially during a certain period of time, non-stop crying, non-consolable cry, and it usually lasts at a certain period of time, and usually happens every day at a certain period. So that is usually the sign. Most frequently it's crying, or usually even sometimes burping, a lot of gas, and very difficult to soothe your baby. So that are the signs of colic. Noor asks, normal ke najis baby premi warna hijau gelap dan macam, sorry, I just wait for them to type out the questions. Okay, so again, feel free to ask any questions at all, and if you missed whatever that we would discuss earlier or shared earlier, you can review back this video later. And if you have comments then, or you have questions, then you can actually type it out, and then we'll try to answer your questions later on. Okay, so I get back to the question. Normal ke najis baby premi warna hijau gelap, dan macam mana nak tahu BCG baby jadi ke? Okay, so hi Nur, it really depends, bergantung pada susu apa yang baby anda minum. Katakan baby minum susu badan. So kalau susu badan and ada warna hijau najis, maksudnya kadang-kadang kita risau ada imbalance dalam susunya. So susu ibu, kalau Nur, saya just terangkan sikit lah, susu badan ibu ada, kita panggil susu depan dengan susu belakang. So susu depan tu biasanya yang lebih cair, lebih banyak protein, tapi susu belakang tu yang ada lemak. Okay. Katakan kalau you asyik minum susu, contohnya menyusu sebelah kiri 5 minit, dan lepas tu tukar kepada kanan, susu menyusu lagi 5 minit, so baby asyik dapat susu depan saja. Itu kadang-kadang boleh membuat baby punya najis hijau. Tapi katakan baby ialah minum susu formula, itu agak normal untuk dapat warna najis hijau. Tetapi you kena pastikan baby bukan berak cair. Sebab katakan berak cair, warna hijau tu memang normal. Sebab kadang-kadang satu indikasi baby sedang ada cirit-berit infection ialah warna hijau, tetapi najis biasanya cair. Okay, the other question that Nur asked was, macam mana nak tahu BCG jadi ke tak? So biasanya kita tengok, so dalam beberapa hari yang pertama, actually kalau you tengok BCG cucuk kadang-kadang tak ada tanda pun, tapi lepas 1 minggu 2 minggu macam tu dia start menggelupas, ada keluar nanah, itu maksudnya jadi. Katakan dia langsung tak ada tanda, walaupun lepas 2 minggu sampai up to 1 month tak ada tanda langsung, itu maksudnya tak jadi, and then kemungkinan besar baby kena ulang lagi lah BCG dia. Hi Sink, is grape water and glucose water good for baby? When can we give this to baby? Okay, as a general rule, less than 6 months old, we really try to avoid giving anything other than breast milk or formula milk to your baby, because giving they have enough water in breast milk and also formula milk. It's enough for the hydration of the baby. There is this common concept that we give prep water to prevent colic or to reduce wind, but we don't encourage giving anything other than breast milk and formula milks in babies. Hi Han. Okay, how to care for toddlers' teeth and gums? Alright, okay. Right, so usually it actually starts from newborn itself. So usually when you bathe your baby, do remember to use a soft cloth to wipe the gums. This is to prepare for when they are ready to for teeth eruption. So remember to clean the gums with a soft cloth, of course with cool boiled water. So other things, so when your babies start to have teeth, always remember to use a soft bristle toothbrush or even a cloth just to clean your teeth after feed. So you should generally clean, it's like us adults, we clean twice a day. So for babies the same, once in the morning and once at night. And also just as a general tip on taking care of your baby's tooth and gums, try not to let your baby sleep with bottle teeth in mouth, or even with the breast in the mouth. So if it's not in the middle of the night feeds, after the night feed, usually just try to clean again your baby's mouth and tooth and gums with again a soft bristle tooth or a toothbrush or a gentle cloth. Hi Rashida, normal tak kalau anak minum formula 2 kali sehari? Selera makan depends on his mood. Anak 1 year 1 month. Okay, Rashida, so actually kita cakap katakan 6 bulan hingga 1 tahun memang kebanyakan nutrisi bayi memang dari susu lagi. So sekarang dia makan ialah depending on mood, tetapi minum susu 2 kali sehari. So kita kena tengok lah Rashidah sama ada baby punya berat badan okey ke tak, whether dia punya perkembangan okey ke tak. Sebab kadang-kadang ada setengah budak dia pemakan yang bagus, macam contoh dia makan banyak, dia minum banyak, tetapi asalkan ada pula yang makan sikit, tapi asalkan dia punya berat badan memang naik ikut dia punya graph sendiri, and then baby aktif, biasanya okey. Tetapi katakan 2 kali saya rasa masih kurang lagi Puan Rashidah. So kita akan kalau Puan interested boleh bawa untuk doktor check untuk tengok whether dia ada masalah lain ke tak. Hi Kiel Sean, is it safe to sunbathe the baby if she has jaundice, or is the UV light a better option? Okay, Sean, thanks for the question. So baby, yes, jaundice is a common cause of concern for parents as well. Phototherapy, so let's say if your baby is having jaundice, above a certain level you need to have treatment. So the treatment is phototherapy, which is a special light that will try to reduce the levels of the jaundice in your baby. No, we do not recommend sunbathing, because we have to understand that sunbathing can actually cause dehydration and even sunburn in your baby. So the other thing is also, you must remember that our world nowadays, the ozone layer is getting thinner, so the rays and all is not really good for your baby. And again, it's a very specific phototherapy light, not our fluorescent light, not bulb light. So it's a specific light that we use to help in the process of reducing the jaundice. I hope this answers your question. Hi Don, my friend's baby stool is white. Is that normal? No, that is not normal. You will definitely need to consult the doctor immediately, because our stool get color from bile that is produced in the liver. So if your baby's stool is white, what we are concerned about is whether there is a blockage in the liver that is causing the bile to actually produce color, to stain your stool with color. So definitely need immediate doctor consult. Hi Sing, okay, thank you Sing. Okay, alright, so thank you all. So again, if there is any questions that I didn't answer, I will try to get to answer your question in the comments later on. Thank you and stay tuned. Take care.